COVID-19 infections clearly started to rise after Super Saturday, according to an analysis of official data that has revealed the number of Britons being diagnosed each day is now 54% higher than it was a week ago as the outbreak continues to grow. Hundreds of thousands flocked to pubs, restaurants and hairdressers after they were finally allowed to reopen on July 4 after months of being closed to help contain the UK's coronavirus crisis. Leading scientists warned it would cause a spike in infections while others insisted it was time the nation learns to live with the virus. Mail Online's crunching of government statistics shows COVID-19 infections started to rise within days of Brits being given freedom to enjoy the summer without being cooped up at home. Doctors say it can take patients up to 2 weeks to develop a cough or other telltale symptoms of the disease. Department of Health figures reveal the rolling 7-day average of daily cases on July 9 was 556, down 32% on the week before. But the growth rate had dropped from the -39% the previous day, showing that the outbreak wasn't shrinking as quickly. But it was not just a one-off. Statistics show the rate quickly started to spiral upwards, with July 13, 624 being a 6% jump on the previous week, 590. This was the first time the rate was positive, showing the outbreak had grown since the start of May when testing was massively ramped up to help officials get on top of the pandemic. Infections began to dip off in the middle of August, but it is not clear why. They soon started to pick up towards the end of the month and spiraled after the bank holiday and over the start of September when millions of children went back to school and workers dashed back to the offices. Growth rates plunged around mid-September when Prime Minister Boris Johnson introduced the Rule of 6 in a desperate attempt to curb spiraling rates of coronavirus. The average number of daily infections compared to the week hit a high of 84% on September 12 but fell every day until September 19, government statistics show. They have risen for 6 consecutive days since then, Mail Online can reveal. Health chiefs announced another 6,874 cases yesterday, meaning the 7-day rolling average, 5,329, is 54% higher than it was a week ago, 3,466. By contrast, the rate yesterday was 48% higher than it was last Thursday. Some top scientists had insisted there was not a true rise in cases because the test positivity rate, how many cases are found for every swab completed, had not changed wildly, suggesting any spike is down to swabbing capacity being ramped up. However, this appears to no longer be the case, with government data showing around 20 out of every 1,000 people are testing positive now, up from the 15 on September 12. It comes as chief scientific advisors to the government, Professor Chris Whitty and Sir Patrick Vallance, terrified the nation by their gloomy prediction that cases may reach 50,000 per day by mid-October if nothing is done. They claimed infections were doubling every week in line with growing outbreaks in Spain and France. But scientists shot down the claims, warning it was based on old data that relied on just a few hundred positive cases. Even Boris Johnson distanced himself from the claims, saying the outbreak could be doubling up to every 20 days. Other figures from NHS Test and Trace also suggest cases had dwindled last week. But the newest statistics, released yesterday, only go up until September 16, meaning any spike in the past week has yet to be confirmed in another government data set. Department of Health figures show the doubling rate of cases is around 2 weeks. Almost 5,000 people are being diagnosed with COVID-19 every day at the moment, up from 2,500 on September 10. But this is based on lab-confirmed infections, and thousands of patients won't ever develop any symptoms. The Office for National Statistics, ONS, which tracks the size of the outbreak by carrying out thousands of random swab tests, estimates cases have risen 60% in a week to 9,600 a day. while King's College London researchers, who are behind a symptom tracking app, say it has doubled over the same time frame to around 16,000. Matt Hancock yesterday suggested the true number of cases occurring each day was in the region of 10,000. And the health secretary pointed out that the spike now is nowhere near levels seen during the darkest days of the crisis in March and April, when 100,000 people were getting infected every 24 hours. Yesterday, a record high daily cases of 6,874 cases were diagnosed, a huge rise compared to last Friday when 4,322 people were diagnosed with the disease. But millions of Brits went undiagnosed during the first wave of the pandemic due to the government's lackluster testing regime, so it is impossible to accurately compare numbers now to those in March and April. Top experts say more than 100,000 people were actually catching the virus every day during the darkest days of the first wave. Now, estimates range between 9,600 and even 18,000. The latter estimate was suggested by Dr. Julian Tang, a respiratory disease expert at the University of Leicester, who claimed the actual number of cases occurring each day in England now may be 3 times greater than what official figures show because of how common asymptomatic patients are. Since reporting of cases varies greatly from the start of the pandemic and even now, day to day, it is helpful to look at a wider time span for signs of change in the outbreak. This provides a clearer picture of where the pandemic is accelerating, staying the same, or reducing because it less affected by daily variations in reporting. Data shows the rolling 7-day average currently stands at 5,329. That means, over the past 7 days, that many people have been diagnosed in the UK every 24 hours, on average. The figure is 54% higher than that recorded last Friday, 3,466. And it has been increasing every day for the past 6 days. Cases have not been shrinking since the end of August, when the 7-day average was in minus figures for 4 days running. And from around April 17 to July 12, the average consistently fell because of lockdown. Between 9,000 and 16,000 Britons are catching COVID-19 every day. Data shows between 9,000 and 16,000 Britons are getting infected with coronavirus every day, according to researchers monitoring the UK's outbreak. King's College London, KCL, scientists behind the COVID Symptom Tracker mobile app estimate that there were at least 16,310 daily cases of the disease in the last week, more than double the 7,536 estimated last week. The Office for National Statistics, a government-run agency, has made a more modest estimate yesterday, saying it thinks around 9,600 people are contracting the virus every day, a 60% rise from the 6,000 a week prior. Both surveillance projects are picking up far more than the government's official testing program, which recorded 6,000 plus cases on Thursday and Wednesday. KCL collects its data by sending tests to people who report telltale symptoms of COVID-19 into the mobile app, while the ONS study sends tests to random households regardless of their health status. Data from the symptom tracking app, which has seen millions of Brits sign up and report their symptoms, suggests there are nearly 150,000 people currently suffering symptomatic COVID-19, although many more will have no symptoms. This figure has more than doubled since last week, when there were about 70,000 symptomatic patients. The chief scientist behind the app said it was fresh evidence the crisis was rising at an alarming rate. On Monday, Sir Patrick Vallance and Chris Whitty made a stark forecast of 50,000 coronavirus infections per day by mid-October, which could lead to some 200 deaths a day by November. But it has since been revealed this scenario, claimed not to be a prediction, was based on studies involving just hundreds of positive cases. A spokesman for Surveillance confirmed on Tuesday that the 7-day estimate was heavily based on findings of the weekly survey of the Office for National Statistics and the REACT-1 survey by Imperial College London. The studies test a random sample of 100,000 people but, as the virus is circulating at low levels, they have to base their predictions off only a few hundred positive cases. In the last REACT-1 study on September 7, they spotted 136 coronavirus cases out of 153,000 people sampled. The low number led them to predict that infections could double every 7 days. This doubling every 7 days was used by the government's top scientists to reach a scenario in which 50,000 cases a day were being diagnosed in October. The government admitted it used these surveys as opposed to actual testing data because it was worried that the figures lagged behind the spread of the disease. Even the Prime Minister appeared to undermine the pair on Tuesday when he admitted cases in the UK could be taking as long as 20 days to double in number. The same day the terrifying predictions were lambasted as implausible by scientists, Mr. Johnson stood in front of the House of Commons to unveil a wave of new measures designed to stop the spread of the disease, including making the army available to help police enforce stringent new coronavirus rules such as a 10 p.m. curfew on pubs and restaurants. Figures based on diagnosed cases alone suggest the outbreak is doubling every 14 days, rising from an average of 2,527 infections a day on September 10 to 4,964 yesterday. Meanwhile, the growth rate suggests cases are doubling between every 10 to 20 days. The size of the growth rate indicates the speed of change. Yesterday the Scientific Advisory Group for Emergencies, SAGE, reported the growth rate was growing by between 4 and 8% each day, up from the 2 to 7% they reported last week. The range they gave on September 11, 2 weeks ago, was from -1 to 3%, meaning there was some possibility that the number of new cases might still be falling slowly. Professor Kevin McConway, a statistician at the Open University, said, a 4% daily growth rate corresponds to a 32% weekly growth rate. And it corresponds to a time of about 18 days for the number of infections to double. An 8% daily growth rate corresponds to a weekly growth rate of about 71%, and a doubling time of about 9 days, just a bit over a week. So, in very broad terms, these growth rates do match the conclusions on the growth of new cases in yesterday's update on the ONS infection survey. And they are certainly big enough to be worrying. Scientists say the more testing, the more cases are found in the community and reported by the government. This can give the impression there are more infections in the population when there are not. Testing has been ramped up over the summer, doubling from a daily average of 112,000 on July 16 to 227,000 a day now. During this period, government-reported cases have increased 8-fold. A useful measurement of whether cases are on the up due to testing or a genuine increase in spread is the test positivity rate, the number of people who test positive out of the total number swabbed. Department of Health data shows 19.83 of every 1,000 people are testing positive for the virus under the current testing scheme, up from 5 in July and 13 2 weeks ago. It's been rising steadily over July, August and September as a number of coronavirus restrictions were eased and people were encouraged to go back to work, eat out to help out, and children went back to school.